Welcome to Discovering with Dr. Deb. Our last season, we were discovering the Enneagram with Dr. Deb, and it was packed with a lot of information while also being a lot of fun to talk about and explore the Enneagram and why we do what we do. So go back and check out those episodes if you haven't seen them already. Here we are in season 2, and I'm going to be focusing on trauma and using EMDR therapy as a tool to help process trauma. My co-host for this season is psychologist Dr. Christie Sprowls from Austin, Texas. She has traveled all over the world to provide EMDR in humanitarian efforts, and she has also trained clinicians and providers in EMDR therapy. So get ready, let's dive right in and talk about trauma. Hello, we've done a lot of talking during this season of Discovering with Dr. Deb about EMDR and trauma, and today's not going to be any different. We're going to talk with Dr. Christie Sprowls about childhood trauma. So I have a lot of clients that come in and they recognize unresolved issues from childhood, maybe a parent's divorce or the death of a parent, some things like that, and it's affected them later. And then sometimes even we have children coming in.
That's right.
And it's a recent event that's happened. Maybe they've moved or lost a friend. And we'll have another episode too. We haven't got it all firmed up yet, but we're going to talk more about grief and the different things that, losses that we experience that are kind of in the grief umbrella, under the grief umbrella. But childhood trauma, when we did our first episode about trauma alone, a lot of it stems from childhood.
Yes.
Right?
Yes.
And we've talked in other episodes when we did like case conceptualization and that we target what they're coming in with, but sometimes we find that in the back, in the history, there's something traumatic or multiple things traumatic that happened in childhood.
Yes.
I want to first talk about like if an adult comes in and they just volunteer information that they had a parent that died when they were 6 or they had a parent that died when they were 4.
Yeah.
Yeah. I think really I have a close friend. She won't mind me sharing this. Her mom died when she was a little girl. Her dad remarried to a wonderful woman. And so often we think, I really had a good life. So I shouldn't feel fill in the blank. You know, I should be thankful. I should be grateful. I love her. I love she raised me.
Yes.
It's still traumatic though.
Absolutely.
Yeah, because a sense of like who you are is gone. And in a lot of those circumstances, and this was her situation too, like there was no mention of mom after that, you know. And I know for my mom's, that's her story too. Her mom died when she was, I think 6 from tuberculosis way back. And dad remarried and, you know, had other family, you know. And so it's kind of like part of it affects part of their identity. It affects part of their who they are, you know. Where do I fit in? Because sometimes then there's blended families.
Yes. And
all of that. So how would you kind of work with a client that comes in for that?
Okay. Are you talking about an adult who's coming in?
Let's start there. Okay. An adult who's coming in and they just volunteer like this is part of their history. And they recognize it's really never been dealt with. Because as we know, like they don't deal with it. Like they put a cap on it and shove it back to the corner because they don't want to draw attention.
Yes.
Right? There's already enough upheaval and chaos and change. Maybe it's not even bad, but just change in the family. So they don't, there's no space for them to process it.
I have so many cases that are exactly that way. You know, they come in, they're not happy, they don't feel very well, they're depressed, anxious, you know, all different kinds of things, and also still grieving.
Absolutely.
You know, one of the things that we talk about as therapists is that if you lose a parent and a sibling and anything, if you have a loss early on, that it doesn't ever seem to go away, right? That pain of the loss, and oftentimes, especially if you're a child, right? You're an adult, but this happened in childhood.
Right.
then you don't have a voice.
Right.
Parents get remarried.
Right.
Maybe the bio mom is going to like do what the new dad wants you to do, and you have to listen to the new rules that are happening. I mean, it's pretty profound.
It is. It is. And here I'm sitting here thinking, well, that was our experience. I didn't even offer that as a
Yes.
When my husband died, my son was 12, my daughter was 4. And then my husband was widowed as well. His daughter was 4. And yeah, they have no say, and they're thrust into this new family.
Yes, that's right.
And then it's like, here's your new family.
Everybody happy.
There's no recognition. And, I take some responsibility for it. I wouldn't say guilt or shame.
Yeah.
But I think we do that, though,
yes.
as people. We're just like, oh, I feel guilty because we didn't, like, who's taught how to process grief?
Yes.
You know, as a society, we are very death denying.
Yes.
And we just, like, it's so sad for you for 30 days, and then we move on. And so we aren't really taught how to deal with our own grief, let alone the grief or whatever of our children. And so they just come in then, and it's like not really ever been processed. They haven't had space to really kind of identify. Yes. And like that loss, I mean, sometimes people say, well, that's grief, it's not trauma. Hello.
Yeah. Yes.
Grief is traumatic.
Yes.
Like I think we can say they're married.
Yes, I agree.
Okay.
Couldn't agree more.
Right. And so these children grow up then, and part of who they are is missing. And how do I make sense in the world? And then also depending on the nature of the death, or the nature of whatever happened, it could be other things too, but just the nature of that, do they feel safe? Do they feel secure? Is the other parent going to die?
Yes.
What if it was a sudden death, if it was an accident, if it was a loss by suicide?
Yes.
This is going to affect them profoundly.
Absolutely.
And then how many of them, I think we're getting a little better societally now, like people will call the practice and, we've got these children, their parent died. And it's like, good for you. You know, of course, sometimes I see the children and I'm like, what are you doing to the parent? And they're not doing anything. Come on in. There's room for you too.
Yeah.
But these children, like I said, and we can do a lot of things. Talk a little bit about I haven't worked a whole lot using EMDR with children.
Okay.
With grief. What are some things that you do to help them process it with using EMDR?
It's really pretty amazing. So again, I've had so many different cases, but this one I'll share. And so all of you, it's a tender one. Be prepared if you don't want to listen. I would recommend you go. So there was a case where a mother was driving. She had 3 children in the car, and her light was green. She drove through the green light and got smacked by a semi. Oh. In the process, everybody was injured and had to go to the hospital, but her daughter died. One of the daughters died, and the little boy was there. He was about 2.5 at the time, 2.5. And what he was doing was every day he would go home and he would put pictures of his sister that had passed on the floor and just look at him and look at him. And then every time he heard an ambulance, he would just like start...
Startle response.
Yes, exactly. Well, he had been talking prior to that, but also after the accident he quit talking.
Of course.
And of course, it's a limited talking, but nonetheless he could communicate. Silent. When I got them, he was already somewhere around 3, pretty close to 3, if not 3. And how do you do EMDR therapy with somebody who is not talking?
Exactly.
Okay.
Sure.
Let's put our little hats on and think about this.
Uh-huh.
And that's actually a lot of the fun of doing EMDR and having it done is so very creative. But there are these types of people. There's a psychiatrist out of San Francisco who has created a method to deal with either children who can't talk or they're pre-verbal, whatever.
They're nonverbal.
They're nonverbal.
It's
Yeah. So she created this thing with EMDR where the mom can hold the child in their lap and recount the story The child can be listening to it
Okay.
while I am doing bilateral stimulation on the child.
Gotcha.
Okay.
Okay.
And this one, I mean, to me, this was just amazing. So she told the story over and over. And where my office is close to an emergency center.
You're going to hear sirens.
Yes.
Sure.
So we heard sirens.
Yes.
We had the talks, and we even let him choose what type of bilateral stimulation he liked,
Okay.
even though he was so little.
Yeah.
And the kids love the buzzers.
Okay.
And
Buzzers
so-
or tappers?
Yeah,
or, yes?
tappers,
Uh-huh.
right? I always
Uh-huh.
talk about them like cats purring, in your little hands, so it doesn't scare people, because some people it scares. But anyway, so he had these things, and then he's looking at his mom, and she's telling the story. We actually probably only met 4 times.
Wow.
Okay. And he'd come in to my office, and so I hooked him up, right? He really loved those pulsars, and he'd come in and he'd just be like, Where are they? Where
Yeah,
are they?
yeah.
He wanted to be hooked up immediately.
Okay.
Is that not crazy?
Yeah.
I mean, he's so little.
Yeah.
Okay, so anyway, we continued with that method.
Yes.
There are others, but this was
Sure.
what we did.
Sure.
I didn't even, well, I won't go into the details about that. But anyway, here we did. We had this story. We did it multiple times. He would go home. How's he doing? Well, he's actually doing better.
Okay.
He said a word or two, right? He's eating regularly. Okay, great. Next time, come back in. We do it. They leave. What happened in the week? Well, he quit putting the pictures of his sister out.
Oh, okay.
And, and he seems just happier.
Okay.
And also an emergency vehicle passed, and I didn't notice the same. There was some, but I didn't notice the same response.
The intensity.
The intensity had been declining. And for the 4th session, it was really about fabulous. Things are going extremely well. He has adapted. He's going into some daycare. He's playing. He is himself again.
Wow.
He does not respond to the vehicles, and he appears to be doing much better, back on a normal track. Crazy.
Crazy.
Then I have to tell the one too about the itty bitty baby.
Yes.
Okay.
Yes, I want you to share that one.
Okay.
Yes.
Okay,
So
so-
this is really, so the baby, and we talked to, and one of them we may do an episode on like adoption trauma.
Yeah.
but,
Yes, because that's so important.
but this story is about a child who had childbirth trauma.
Yes.
He was traumatized during birth.
Yes.
Right?
Yes.
Okay, so, because you think and one question we get is, how young of a person can you do EMDR with?
That's correct.
So this is a new infant,
Yeah.
right?
Brand new, just
Brand
born.
new, just out of the womb. Okay, tell the story.
And was actually a complex child. I mean, they had to go to the NICU, and the parents couldn't go. And so, anyway, in the NICU, this little baby is getting tubes and stuck, and all kinds of things are happening
Right.
for this little bitty baby.
Trauma.
Trauma.
Yes.
With a capital T.
Capital T, big T
I mean,
trauma.
and there's little things just in this earth, just a few minutes, and he's whisked away, and he's already getting, everything poking him,
know.
and poor thing. So this is what was done. Brand new baby.
Right.
Grabbed the little feet, and when the nurse would come and stick him or any kind of tubes down the throat, it'd be like, oh, mind you, he's screaming at the top of his lungs.
Right.
Oh, that mean old nurse.
Right.
Jeez.
So you're just doing bilateral
Bilateral
stimulation
stimulation
on his little feet.
Little feet, back and forth. Oh,
Yes.
that mean old nurse. And everything's gonna be all right. Oh, that mean old nurse. Yeah, and everything's gonna be all right. That baby quieted down, gives me goosebumps to this day. That baby quit crying, quit yelping. I mean, you know how they can scream and yell, and became calm. And the nurse goes, "How? What?
What are you doing?
What did you just do?
What did you just do?
I've never seen this happen. What are you doing?"
Yeah.
And nothing. Oh, nothing. Just talking to the baby.
Just talking to the baby. Yes. Yes.
So anyway, I mean, I really truly do think that EMDR, how we can use it and what circumstances we can use it, that we're just like the tip of the iceberg, because it keeps evolving. But those are 2 examples of young kids. There's so many things like kids eating Pop Rocks or something like that, and it gets caught in their throat, and then they stop eating.
Yes.
You know, they have a traumatic experience, or they have their best friend die. I had that this week.
Yes.
Or, you know, last week, whatever. And, you know, how do you, Uvalde? Oh my gosh.
Oh,
you know,
yeah.
sorry about that, but that's what I do.
Mm-hmm.
Heartbreaking.
Heartbreaking.
In so many ways.
Right.
So, but all of that, if they have the help and the support, just like that little boy,
Mm-hmm.
he, you know, you can work with them sometimes a lot faster than adults because they don't have the neural network
Right.
all involved
Right.
yet.
And it's not complex.
No, that's right.
You know,
That's
they don't
exactly
have
right.
this history.
That's right.
And this isn't just a trauma response, a trigger to a bunch of things.
Yes.
You know, this is just usually an isolated situation.
Yes.
And we're just helping them reprocess and creating new neural networks
Yes.
about
That's
that
right.
event.
That's right.
So their body, it doesn't get stuck and hidden.
Yeah. Yes. Exactly.
Right.
Exactly. They can move through it.
They can move
because
through it.
we are designed as humans. This is a
Right.
part of what EMDR believes. We are designed as humans to heal psychologically, just like we heal our bodies. But you know, things get in the way. Sometimes life. Sometimes I'll just keep real busy. nothing's happening.
Right. Yeah.
You know, that, I mean, we do lots of different kinds of things, but anyway, yeah.
Yeah.
It doesn't stay lodged. There's nothing to connect to anymore. It's not a reality.
So we talked about using when they're young. And a lot of times, like I said, when we kind of start talking, they come in and it happened a long time ago.
yeah,
And I know in other episodes we talked about dealing with the target memory,
Yes.
because usually that's not what brings them in. Sometimes they'll mention it, they'll volunteer that information, but what brings them in is a relationship situation.
That's right.
Or a toxic work environment, or other things. But if they volunteer that and they're welcome to go back there, you know, you said before too that we'll look at the first time they noticed symptoms, the worst time, and then the most recent. So a lot of times, my daughter was 4 when her dad died. Both of our girls were 4. And so it's like, to go ahead and go back there, we would do it just like we do regular EMDR. We would have them identify an image from that they can conjure up. And it may not be an image from that exactly, but something that is an image that represents that loss. And then identify negative cognition. And a lot of times it's just, like I said, this loss of security,
yes,
loss of identity, you know, loss of safety. You know, a lot of times it's related to that with the death of a parent. And then we go from there, and we're going to do EMDR. And then there's really, it's been amazing to see the relief that I've had from clients that have had that kind of experience.
Yes.
And then we go through it. And they usually don't say, if they're an adult coming in and it was a death of a parent, like their level of disturbance is usually not a 10. You know, because they've lived with this now for 20 years, 30 years, or whatever. But it's usually still a 5 or a 6, sometimes maybe even a 7, because it's never going to be okay. And when we do that psychoeducation, the first couple of sessions, like they're going to say, and almost always they say, well, I'm not going to get down to a 0. Like,
yeah,
and I'm like, well, it's never going to be okay that you lost a parent. Like, that's not how things are supposed to go, you know, especially when you have children. We're not saying that it's okay. We're just saying it's not disturbing you in your everyday life.
yes,
And it doesn't mean you're not going to miss them or long for them or grieve. That's a whole different.
yes.
You're always going, like you said, you're always going to miss them. The grief is never going to go away. It's just you learn to live with that aspect of yourself.
Yes, and I feel like I've had a lot of loss in my life. Okay. And I want to testify to this that you know, loss is very complex, and I wonder sometimes how, as human beings, have we been able to lose the people we love and continue to live,
Right.
and continue to march on.
Right.
And well, it happens, and it's happened for centuries and everything. So it's okay. Well, part of that, you know, maybe faith, which we've talked about. But I have to say, in the very severe losses, that I have gotten over the grief. Do I miss them? Yes.
Yeah.
and we can talk more about this when we're talking about grief, because I really do feel like it's very powerful. And anyway, well, we can talk some more about that, but I just wanted to say that, like, for me, the mom of this kid, this is grief talk, so I want to kind of, I'll shelf that. But you're correct. It's like, can you learn, you've been carrying this burden around your whole life about losing your mom or your spouse or whomever you might have lost. What needs to happen for them? And so that's what we go for.
We're going to unpack that.
Yeah,
when we talk about grief.
Yes.
So be watching for that. It'll come up in the next several, 2-3 episodes. We're going to have one where we talk more about grief and EMDR. So I hope you check that out. And if you haven't already, go back and watch some of our earlier episodes. So we've got a bunch just about trauma and EMDR. And even last season, we have Enneagram, discovering Dr. Deb with the Enneagram. So hope you check those out, and we'll see you next time. If this content has been helpful to you, I'd appreciate it if you would please rate the podcast, post it, and share it on social media. And also post a review. If you'd like to get in contact with me, my phone is 479-561-7600, or email Dr. Deborah at anchoredhopecounseling.net or Dr. Deborah at drdebfordoctors.com. Our website at www.anchoredhopecounseling.net has some useful information, and you can also reach out to me through the website. Remember, you are enough just the way you are, and you are loved.